Conversational hypnosis is a simple method that truly helps our clients to have a very, very fast results. However, there are some challenges, like with anything, to learn it. It is normal to have these challenges whenever we're learning something new. But one of the very unconventional things that new conversational hypnosis practitioners actually have trouble with is being seen by clients. And I know that sounds very unusual, right? But a lot of the conversational hypnosis students are coming from a background of hypnotherapy, right? Because the conversational hypnosis program is all about up leveling our therapeutic skills to help our clients faster. So most of them have a history with helping clients through hypnotherapy. And what does traditional hypnotherapy modalities usually begin with? In terms of what our clients are needing to do, it's closing our client's eyes, right? That's usually the first thing we do. Okay, relax, close your eyes, look up, and then close your eyes and relax your body. Most hypnotherapy modalities are like that, right? And so what's really interesting is that a lot of students, and this is actually quite common, so no shame in this, a lot of students are at first a bit hesitant because they're so used to, their clients just having their eyes closed and them looking through their notes or through their scripts. And when it's just really just sitting down in front of a client where a client is really just focused on us, really the client is focused on themselves, but it's just a perception of like it's really just an intense one-to-one conversations that makes some of the newer practitioners freeze a little bit. And I want to talk about this now because this is such an interesting concept and a block that some might not have. What are your thoughts on that? If you are so used to your clients closing your eyes, what is it like to just have a regular conversation, eyes open, right? Because in conversational hypnosis, we don't really care about eyes open or eyes closed. It doesn't really matter. What matters is the actual conversation with the unconscious mind. So what is that like for you? I would really love to know what your thoughts are on that. And recently, one of the demos that we had inside the ACH program was someone who was really scared to be seen by the client, which is really, really interesting because, of course, that is just a symptom, right? Being seen by the client, it just seems that it's the biggest problem at that present moment because that's what the client was experiencing, this new ACH practitioner. But really, what was underneath was that fear of being seen, and there were so many other instances that related to her personal life that actually drove that problem. And that's why I love conversational hypnosis so much. It's because we start with a superficial layer problem of saying, you know, I'm actually weirdly frightened of my client seeing me and having an eyes open conversation, but what it actually is was something to do with her identity and how she recognized and perceived herself and her personality. And in conversational hypnosis sessions, these types of conversations are so common where we think it's like a superficial level layer problem, but what we actually help our clients with is a complete change in identity. So what are your thoughts with regards to having a conversation with your clients? Are you so excited for it, or is there some discomfort, maybe even fear? I would love to know. Let me know. If you have any questions at all, I'll also ask away. Otherwise, I will see you soon. Let's make a massive impact together, one conversation